I'm Laura Bonnell, and this is the Living with Cystic Fibrosis podcast coming to you from Detroit. Please subscribe and even rate and comment on our podcasts when it moves you. I learn something new with every podcast, and I'm always inspired by the people that are showcased here. We don't give medical advice. You need to connect with your doctor for that. I hope that this Living with Cystic Fibrosis podcast educates you and sparks some volunteering or advocacy. The CF community needs people like you. Thanks to our sponsors, Viatris and Vertex, for their support. I encourage everyone to attend conferences when you can. I meet the most interesting experts in the fields in the nonprofit world. I meet so many great people every time I attend a conference, so I highly recommend it. From scientists to pharma to other nonprofit execs like me. And I was thrilled to meet Jenifer Waldrop. She joined the Black Women's Health Imperative as the executive director of the Rare Disease Diversity Coalition in October of 2022. And the organization addresses challenges faced by rare disease patients of color. And they bring together rare disease experts, health and diversity experts as well. And their vision is a world without health disparities in rare disease patient communities. And the mission is to address the extraordinary challenges faced by historically underrepresented rare disease patients as encompassed by social determinants of health. She volunteers as a professional development director of the National Association of Asian American Professionals of Colorado, and we're delighted to have her. Welcome, Jenifer. It's so great to have you on the Living with Cystic Fibrosis podcast. What disparities affect people with a rare disease? Not everyone probably is familiar with the fact that it does have a huge impact.
Great. Thank you. Thank you for having me on today. It's a pleasure to be here. There are several factors that actually do impact folks with a rare disease. Simply by the name of somebody that is living with a rare disease, it is considered rare, meaning that perhaps you may or not know somebody with a rare disease. There are studies out there that show that 1 in 10 in the United States actually have a rare disease. And so, if you think about somebody in the room of an event or in an elevator, there's a good chance that somebody in there might have a rare disease. But depending on who you know in your network, you personally may not actually know somebody that might be living with a rare disease. So that in itself actually can create some sort of disparities because, folks living with a rare disease, the disease itself can be very unique given the fact that there are over 10,000 types of rare diseases. And not every single doctor, provider, nurse practitioner, etc., actually might be familiar with that particular rare disease, which then makes it really difficult to either diagnose the disease in a timely manner, in a short diagnosis period, or it may also make it difficult for folks that once they have their diagnosis, what do they do for their next steps? So there's lots of different reasons why disparities exist in rare diseases. It's finding the care for that rare disease if you're so fortunate to be able to have a diagnosis for that rare disease, getting the appropriate care that's required depending on the type of disease that's been diagnosed, and also really the effective treatments. Did you know here in the United States with the US FDA, about 95% of rare diseases do not have a treatment, which means that there are only about 5% out there that actually have a treatment. So if you think about over 10,000 rare diseases that we've identified from scientists, only 5% of those actually have treatments. So all of those create some level of disparities. And then when you think about it through the lens of some differences in people's standard of living and where they live and how they live, that could also create another level of disparities.
That's one of the things that I was so excited about when I saw your booth at the NORD conference and met you, was because we think about that, but when I saw that there was an organization that addressed this, because we're all individually trying to do things to raise awareness in the cystic fibrosis community about people of color being underdiagnosed. And people think about it, but you are this umbrella group, this group that is dealing with everything. So talk about what the barriers can be. I just read an article just before we got started here about barriers that the Hispanic community runs into with rare diseases and how it changes based on what the health insurance situation and plan is in the United States. So there's so much information. But what are the barriers that you see? Because, I've watched previous talks that you've done, and you talk about the scatter population, isolation, stigma, all sorts of things. So tell us about, what you're seeing in the rare population.
Great, thank you. And you're right, we are an umbrella organization when it comes to rare diseases. We also an organization that is focused on the historically underrepresented or marginalized population. And you just mentioned NORD, the National Organization for Rare Disorders, really instrumental in the orphan drug bill, that organization. And they're also a coalition member of RDDC. And so with NORD, actually, we did a study 2 summers ago, not too long ago, regarding what are the barriers to care, barriers to access for rare disease patients. And we wanted to ensure that the information that we were collecting is from the historically underrepresented populations. And we were really successful in the number of respondents to that study and then the information that we found. And as you mentioned, within that information that we found, the patients and caregivers identified that they did have indeed access issues such as transportations. So finding access to their provider, to their treatments, for example. So if you live out perhaps either in the suburbs or in the country, you may need more time to get into the city, and that can either require a couple of different ways of getting into the city. It may require different types of trains or a couple buses to get there. So time is also a factor there. So you've got transportation, and time is a true barrier. If you're so lucky to have something within ground transportation period, sometimes you actually have to fly to certain places for your treatments. We've got plenty of patients that are part of our coalition that have shared stories where they do need to fly to see their provider because that provider is a specialist. Sometimes they're doing it within their own time zone, and sometimes they're doing it across time zones as well. So that those things can be real barriers for the individual patients. And if patients are parents, for example, and they have childcare needs, that adds another concern within their with living with a rare disease. So hopefully that gives you a couple ideas as to why there are certainly barriers to rare disease patients if they're not getting the access and treatments to them in a convenient way.
And like any other situation, those of us who don't have those challenges probably don't think about it, don't even realize it. Wouldn't you say? I mean, if you don't have a problem with transportation, you might not be thinking that others would, but it's really important to know all this so that my foundation or other foundations can address it and know about it and share the information.
Absolutely. So sometimes you might think, I live in Chicago. It's a great city. It has some really great medical care. Unfortunately, I was recently diagnosed with a rare disease. I should be able to get treatment at one of my local hospitals or at least within the greater Chicago area. That certainly is not the case for every patient living with a rare disease. Recently, we've been talking to some patients in Chicago, and they've actually educated their own doctors about the recent treatments. So we always say that most of the time, because of the nature of rare diseases, patients can be more of the expert than some actual doctors and other specialists.
Oh, for sure.
And so this particular patient is traveling to the East Coast because they prefer or they have a specialist doctor that is really knowledgeable and experienced with their rare disease. So sure enough, they've got to hop on a plane and go across a couple of time zones. And with that, hopping on a plane can also be very expensive. And to your point, for folks that actually may not be thinking about both the proximity to seeing certain places for treatment as well as costs. And so cost can also be a major factor for some rare disease patients.
Absolutely. And I think, too, you also talk about being part of the marginalized community. Then you have so many different biases or discrimination or all kinds of things coming at them in addition to their disease, because you address if you're part of the LGBTQ community, and that is education that all of us should know. I need to be a responsible person and know and understand what pronouns are and not dismiss it as, well, we never did that, or why do we have to do that? I think that's such old thinking, and it's so important to just embrace what other people need. Why is it so hard for people to make someone else happy or to just acknowledge their existence? So in addition to having a rare disease, they're dealing with all these really mental health challenges, maybe because they can't get just the basics that they're looking for simply as being addressed in the manner that they would, choose to be addressed.
Absolutely. And if, as part of the LGBTQ community, if you identify with a non-binary or a pronoun that folks did not really consider 100 years ago, for example, or so, that can create a lot of stress and anxiety. So I mentioned that we did a survey with NORD, and the information that we collected actually asked that question, in terms of, did you have barriers to care, barriers to access, and how did you feel? Are you stressed in the current situation that you are in? And in the LGBT community, when we broke down the data set, that particular group, out of different demographics that we were able to identify, was the highest folks that feel the most stress, the most anxiety, feeling hopeless and drained as they are living with rare disease. So absolutely, with the LGBT community, we saw that time and time again. They were willing to share with us how much living with a rare disease has impacted them, has helped them mentally feel, has created a sense of real concern because they identify as LGBTQ.
And so that has to impact their health.
Absolutely, absolutely. It impacts their health, as you know, when you have this level of stress. Stress is toxic to the health in many ways. It can be helpful if you're a competitive runner, for example, but it can also be really harmful in terms of trying to heal. It can also create symptoms that you may not have had before when you recognize that you have this additional stress. So the same thing that within the LGBTQ community, symptoms and psychological limitations were certainly evident that it made dealing with rare diseases very difficult for the LGBTQ community. There was a true delta, a difference between the LGBTQ community, which is the historically underserved population, and then the traditionally served population.
And so how are they doing? How are your efforts in that area? Are you seeing progress, and how's it looking?
I there's still a lot of work to be done. I think there's lots of baby steps that is happening. We have a few coalition members that they do have a specific focus in the LGBT community to really educate and empower, be a resource, know that it's a safe place to come to as one of the coalition members, and as different organizations have this focus. And I think that's part of the challenges when it comes to the rare disease, because in itself, it's pretty isolating, and there are other lived experiences that can also be isolating, unfortunately. And so when you live in the rural population, where you're dealing with poverty, where you're dealing with maybe perhaps you identify as part of the LGBT community, and perhaps as an example, you're a part of all three of those groups, the multiplier effect certainly takes place there. So I would say that there's still a lot of work to be done in this group, in these areas for the historically underrepresented population. But that's why this coalition was created. We here serve as a resource for organization like yours. We are serving as a resource for biotech and pharma companies, for example, and also as we've got partners with the government agencies. And I say all that because, we all could do better in the health equity space. We can't do it alone, and we certainly don't want to do it alone. So we want other organizations and other groups to work with us so that we can help solve this systemic issue that's been going on for a really long time.
And I think a huge part of it is what we're doing now is educating people so maybe they understand it better, or they would also know how to help. If someone wants to be a supporter to what you do, how can they help?
Absolutely. So we are a coalition made up of almost 100 organizations now, and I mentioned a few of the industries that's a part of our organization. That survey I mentioned that we did with NORD, that could only have been done with folks that are part of the coalition. We have 3 working groups that are part of our work, and it's really focused around the patient as the center. So we have the patient and caregiver focus and some of the work that we do there. The provider is also a part of that conversation. So if you identify as any of those, and our definition of provider is pretty broad, we know that rare disease patients not only see their general practitioner and their specialized healthcare provider, but sometimes they're off seeing their physical therapist based on the type of treatment that they might need. So that definition of provider is pretty broad because it can also include pharmacists as well. And so you may have a really great relationship with your local pharmacist. And then we also, of course, are really into the research and clinical trials area. We've got a couple of papers that we've pushed out to publishers, and we're hoping to get published in the new year. They're really focused on the diversity and some of the medically underserved populations that we know in the rare disease space, and we've analyzed that information when it comes to clinical trials. So we've got some of those papers that are coming out. And that can only be done, again, by some of the volunteers and coalition members. And then, of course, we have an advocacy and policy arm. And so we are also working with EveryLife and other organizations when it comes to doing some congressional work on the Hill and advocating in the rare disease space with various bills that do impact the underserved population as well as the rare disease population as a whole. So we encourage folks that are listening to this podcast, for example, to contact my organization, RDDC, on our website, and then you can also join us through using our website volunteer form.
And we have everything in show notes, too, so people can access you. But I also wanted to ask you about diagnosis. In the CF community, we know that people of color are underdiagnosed. What else are you seeing either amongst the LGBTQ population or the, people that are below poverty? Are you seeing a delay in diagnosis for those reasons as well?
Absolutely. So, as you all know, probably in the rare disease space, sometimes they can take up to, or maybe perhaps on average, it's 7 doctors or 7 different providers to be able to be diagnosed with a particular rare disease. I always, when I hear stories from the patients or caregivers, and I hear fewer numbers than that, I feel like that's a win. And so it's kind of sad that if you actually get a diagnosis in a much shorter time frame and with fewer doctors, as opposed to perhaps right away within 1 or 2 specialists. And that's the other thing too, the time frame for the historically represented populations for rare disease patients is 5 to 7 years. With the historically underrepresented populations, and the marginalized populations is actually, you add a few more years to that. So I'm a very visual person. And when I think about the rare disease community and I think about children, I think about perhaps if you think about a child that hasn't been diagnosed and it may be 7 to 9 years old before they are diagnosed, that's a long time. That child at that point is in about 4th grade or so. And so if you think about it through the visualization of that, that could be a really long time that somebody's living with a rare disease if they have symptoms early on.
It also affects their life expectancy because of the delay in treatment and diagnosis and care and medications and specialty and therapy and mental health. It sets them back so far.
Absolutely. Absolutely. And sometimes if they are misdiagnosed along the way, they're really excited that they're diagnosed. And we've heard plenty of stories where they were misdiagnosed along the way. And they're still feeling symptoms and pains and having problems. And then again, to your point about the treatment, that delays the treatment or delays any way of fizzing out the symptoms themselves and suppressing the symptoms during that time period. So there is, for underserved populations, the treatment times and the diagnosis time cannot be much longer than some of the other communities and some of the other populations. So you're absolutely right. It does impact the treatments that they're receiving. It can also be really financially expensive during that time period as well, and it can also their own lived experience is highly impacted in their mobility and other mental pieces of it as well.
And what about people who are below poverty? There's such a stigma to that as well. And does Medicaid help everybody who is, below the federal poverty level? How does everyone know, if they have access to assistance? Or what do you find with that population in regard to help and stigma?
So for those that are using the government insurance, for example, there are certainly limitations based on the schedules and what is allowed within the government insurance. So for example, as I mentioned, not all specialists are available within your own state. And so what happens if you have to go out of state? The government programs don't always allow or pay for assistance and treatment outside of your own state. So absolutely, those that are in the poverty level and they're using government assisted insurance, they are highly impacted as to how much, where they're getting treatment and how they are getting the treatment, for example.
So what do you find as an organization, what your biggest challenge is? When you look to 2025, what do you say is like, wow, we really have to work on this. This turned out to be a bigger deal than maybe we thought?
Yeah, I think that there's a lot of opportunities coming up in 2025, given our new administration, given some of the changes that we are anticipating with some of the government agencies. There's no doubt that there's lots of support from groups like the NIH and the rare disease community. They are trying to make part of their research and part of their funding a major priority for rare diseases. So by having a couple of their leaders discuss this publicly, I'm very excited for the NIH as their focus areas within the rare disease. And the FDA, as you know, has created an innovation hub, and there's another opportunity there within that agency to do more in this space using some of the current new programs that they're putting in place. So 2025 will definitely be an year of opportunity for the rare disease community. We have a couple of bills that are sitting right now with Congress, and hopefully some of them will be passed this year. If not, we'll kick it to hopefully next year. We've got some great relationships with different congressional folks, and they've reached out to us to prepare their 2025 and beyond agenda. And so we are lockstep with many folks and decision makers up on the Hill. So for us, for the RDDC, policy is a big part of what we're focused on in 2025. But like I said, also with the patients, we're hyper-focused on what their needs are, and with this historically underrepresented populations, we're asking them to be a little bit more vocal, to bring forward some of the concerns around the mental health space. One of the things about some of the historically underrepresented populations, whether it's in the LGBTQ community, whether it's through race and ethnicity lens, for example, is that we don't talk enough and we're not as overt in some of the challenges within mental health, and certainly within the rare disease community, that's no exception. So one of the other areas of focus is going to be around improving the mental health opportunities so that we can make a systemic difference.
I mean, it's great work. How has that helped you so far? And I guess kind of what resources do you have for people, somebody who kind of wants to see everything that you offer? What other tools and resources do you have?
Sure. So we're a coalition building organization trying to empower patient advocacy organizations and corporations. And so, there are, like yourself, organizations that are specifically focused on, rare disease. And so we're educating our partners on these topics. And so part of the way that we do that is through participating in our working groups, for example. And also we've recognized Rare Disease Day, which is the last day in February every year. And within that time frame, we've put together some toolkits as well that allows folks to learn a little bit more about either rare diseases themselves or show some statistics around rare disease. And so this information, again, is available on our website that it really empowers and educates folks in the rare disease community as an umbrella organization. But we hone in a little bit on some of the concerns with these historically underrepresented populations. So I think that's a little bit of the difference in the information that we share, that we really think about it through that lens, as opposed to maybe it's just some general rare disease information that we're sharing.
It is really important that everybody does what they're able to do, whether it's a letter to a legislator or it's going to visit, one of the legislators at the Capitol. But do you give advice or help people who want to advocate and help them at whatever level of involvement they're at?
Yeah, we do to a certain extent. I think our information that we're sharing is a little bit more about what there's been gaps in our society in terms of information on rare disease and the historically underrepresented or underserved populations. And that's why a couple of the papers that are coming out and hopefully will be published soon, those papers were created because other organizations, other government agencies were not analyzing some of the data out there currently. And so I think that's really interesting for folks as individuals so that they can kind of see themselves in the research that we have done. Perhaps they've been a part of certain clinical trials or research themselves. And so they can then recognize that they are not alone. That way it's not so isolating. And that we do have a number of different organizations that we list out on our website that do actually have support, whether it's through financial support or other groups that provide other types of peer or other types of support that they might need as well. So because we have almost 100 organizations that are part of the coalition and they're all listed on our website, it gives them a number of different places to go to so that folks can learn a little bit more depending on where they are in their education levels.
Do you have printed material that people can get or download that's on your website if they're interested in sharing or learning more?
We do. I think all of the information that we have on our website, you certainly could print it out. I would recommend perhaps just sharing links with folks. Printing, I know, can be costly, or it can be ineffective as well. So in the spirit of digital age, but I'm recognizing that not everyone has access to the digital systems. But if you do have somebody that has access to the digital system and you prefer to go onto our website, we do have a number of documents on our page that allows you to go there. When you go to our website, you can just kind of look around, and we try to navigate it so it's pretty user friendly. We've got a section around the latest, and in that latest section there's some resources and some research information on there. If you're interested in some of our patient stories, perhaps you want to see somebody that looks like you, or perhaps there's a particular rare disease that we've highlighted that might be of interest to you as well. So we try and have our website that's great for our coalition members, but it's also good for anybody that might just be more interested in the rare disease space and what does that mean for the coalition perspective. And we've actually just received, quite a few folks that just were inquiring because they were looking online and they came into our website as well.
And do you have any stories of success, I'm sure you do, of people who you've helped, or maybe a doctor or healthcare or somebody didn't know that they were putting up barriers to someone because of their disparity? Do you have a story where someone says, oh my gosh, it was because of this that I wasn't getting diagnosed, but once I made them understand, everything went better? Do you have some of those sorts of stories?
I do. I briefly hinted earlier to a patient that's in Chicago. And, she, like, as I mentioned, knows a little bit more about the treatments and diagnosis better than her doctor that she was seeing, for example. And the reason why I brought her up as an example in the story is because she actually has a group of friends and folks that have the same kind of disease. And when she found this group of folks that have the same kind of disease, they're talking about their lived experiences. They're talking about their treatments, and they're getting to the specifics as to, what are you taking as a particular treatment to help with your symptoms. And she was able to share with her doctor the type of medicine that her friend is taking, the type of side effects her friend may have been feeling due to the drug itself. And so through all that, she was able to educate her own doctor that this particular drug might be better for her. It's easier for her to consume, perhaps, in the way that it's created. And she was anticipating perhaps some of the side effects may not be as severe as the current drug that she's currently taking. So she was recommending to her own doctor a particular drug that she wanted her doctor to write her a script for. So I think that is amazing that when you're educating as a patient, you're educating your own doctor about particular drugs that are on the market and available for all. That says a lot about patients and who they're connecting with to also increase their awareness so that they can take essentially a better life for themselves into their own hands.
It's so important. I mean, it's so important to advocate for yourself in addition to legislation, but so important to speak up and have your doctor hear, because then your care is better, right?
Absolutely. And you're living, when your care is better, then you can live better and then you can function better. So it really has this ripple effect so that, you can perhaps, in her case, do better for society, do better for her own family, do better with her friends. Because, of course, symptoms can be so painful. They can be so devastating. They can be so bedridden or hospitalization may, be a factor. So for all those reasons, as you mentioned earlier, too, with getting to treatments sooner, it's better for the patients and it's better for their life expectancy.
Well, thank you. And the Bonnell Foundation definitely wants to, be part of the coalition. We definitely want to help you. So we will talk about that and do whatever we need to do to make it official. But thank you so much for coming on and talking about what you do. And I'm sure people will reach out to you after, this community is made aware of everything that you do.
Thank you. We are trying to do so much in this space for really representing the historically underrepresented populations. We have, like I mentioned, a lot to come in 2025. We look at the current systems in place, as I mentioned, with policy, for example, research is another way. But one of the other things that we're working on is empowering and working with community healthcare workers. Community healthcare workers are really a part of our system here in the United States. And I think it's an opportunity for many to be more involved with the community healthcare workers because they can be a trusted group or a trusted person within certain communities. And as you mentioned earlier, Laura, that many times there's a trust issue with some certain communities based on the history of the United States and the way that the healthcare system has occurred. And so if you have community healthcare workers that can be a partner within communities that you maybe traditionally have not worked with, I implore other folks to work with these groups. And so for us, we're educating community healthcare workers in rare diseases so that we can shore up and maybe decrease the diagnosis time for certain communities as well. So it plays all into many factors into the healthcare area.
Well, you're doing great work. I'm so glad that I met you and know about everything that you do. It's just great stuff. So thank you.
Thank you. I'm so glad that we met. It pays to definitely, attend events in person because you never know who you might come across and you never know what might happen next. So thank you so much for reaching out to us and for allowing the Rare Disease Diversity Coalition to be a part of your library of information.
Thank you.
The original music in this podcast is performed by Kevin Allen.
It's not complicated.
Who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated. But loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org. This podcast was sponsored by Vertex Pharmaceutical, The Science of Possibility, and Viatris. It was produced by Jag and Detroit Podcasts. Follow our show in Apple Podcasts, Spotify, or wherever you're listening right now.